Dear ladies and gentlemen, welcome and thanks for joining our virtual kickoff event on the Desire Internationalization Strategy. My name is Lisa Maria Kadolnik. I work as EU Project Manager within ICS, the Internationalisation Center Styria, and I will guide you through the next hour. To begin with, some important information for you. If you have questions, please do not hesitate to ask them during the presentation. You can use the chat function on the right side of your screen. Not only will the webinar be recorded, but you will also get all the presentations afterwards. And last but not least, in case of technical issues, a colleague of mine can be reached via the chat. Before introducing you shortly to our EU project Desire and our internationalization strategy, let me quickly guide you through today's program and welcome our speakers. Mr. Peter Pesel, who is Head of Technology and Innovation within the Advantage Austria office in London, will give us an update on the UK digital health market. Welcome and thanks for being with us today. Secondly, Mr. Christian Meyer, who is Deputy Head of the Advantage Austria office in Abu Dhabi, will enlighten us on the current trends of the United Arab Emirates e-health market. Welcome and thanks for joining us. So now for everybody that do not already know our project, what is Desire? Desire stands for Development of E-Health Solutions Improving Resilience in Europe, and is one of our EU projects. It is also one of the 30 Euro clusters which have evolved from the EU industrial strategy. So Desire is one of the 2 Euro clusters in the field of health. What do we want to achieve within Desire? We want to help SMEs challenges they face when accessing the European e-health and digital health markets. And the project aims especially at supporting your innovation and internationalization processes. As we say, teamwork makes the dream work. On this graphic, you can see our great team of partners behind this project, consisting of 1 business support organization, 2 IT clusters, 1 from Poland, Interizon, and 1 from Romania, Cluj IT, 2 health clusters, 1 from France, Eurobiomed, and 1 from Austria, the HTS cluster. The project focused 3 main pillars. First, the Desire collaboration platform, which matches companies and stakeholders and offers a lot of webinars and events. Then our Desire open call for funding, which offers in total 1.50 million for SME innovative projects, and 1 SME can get out 30,000 max. You can still apply for the project so that you know until the 13th of November. So use the chance, and it's really an interesting opportunity. And last but not least, the Desire services, offering innovation and internationalization support, a topic that is covered today. All additional info about the project, the services, the open call, and the events can be found on the Desire platform. So now let me briefly tell you what is covered by our internationalization strategy. It builds the basis for the Desire internationalization services that should aim at connecting European entities with entities in third countries, meaning outside the EU borders. After an in-depth analysis of potentially interesting third country markets for e-health solutions, we decided to focus on the United Kingdom and the United Arab Emirates, as they showed to be the most promising markets in that case. What are the main goals of this international strategy? And we want to advance your internationalization process in third country markets support you in finding cooperation partners, for example, suppliers or distributors in third countries. We want to identify global trends and prepare you to enter the target market selected. We will help you acquire more knowledge and capacities in the selected markets for the development of your individual projects. And we intend to do an in-depth analysis of the target markets defined. What does this mean in concrete? What's offer you and how do we want to achieve all these goals? As today is the first webinar, we will have some more on market access and entry, intercultural communication, health regulation and standards. We will have B2B meeting sessions. We will do individual consultation if need be, and we will have 2 fact-finding missions. One outgoing mission to the United Kingdom, which will take place in April, end of April, 23rd to the 25th, and one virtual mission to the United Arab Emirates, which will take place in autumn 2024. So that's the most important things about our strategy. And as I do not want to steal our first speaker any more time, let me directly hand over to Mr. Pesel, our expert in the UK.
Thank you very much and good morning from London. Thank you very much for the kind introduction and that I'm able to be here and talk a little bit about the UK market to everyone. As mentioned, my name is Peter Pesel. I'm head of technology innovation at Advantage Austria, UK, or in German, the Außenwirtschaftscenter der Wirtschaftskammer Österreich in London. Also, the reason why I'm very excited is because by training I'm a biomedical engineer. I've been working in the healthcare sector almost all my life, and also now I'm supporting Austrian companies with the market entry in the UK, and hopefully can provide Austrian but also other companies from other European countries here with some interesting insights. I'm gonna share my presentation right now. One moment. Right. And what I would like to do, going through some this is a sneak preview about the UK digital healthcare market, the most important things you should know before thinking of entering the UK market here. And I think one of the key players here is definitely the National Health Service, and it's also unique in many ways, which is the reason why I would like to spend a few minutes talking about the NHS here and also the challenges and business opportunities that could arise when working together with the NHS. I will, in the end, I will give you some policy context, governmental strategies for the whole UK, so England, Wales, Scotland, Northern Ireland, and bring you some case studies of companies that have already successfully worked together with the NHS or the private health sector here in the UK. And finally, a quick outlook what we can expect to see next. First of all, the UK digital healthcare market, it is a big topic here in the UK. The market itself is valued over £5 billion, and according to a venture capital list survey recently, the UK has the highest number of digital health startups in Europe and has also attracted the most investments in the region over the recent years. So like everywhere else in the world, digital health tech has been accelerated. The adoption has been accelerated during the pandemic. We've seen more phone, online consultations, video meetings, and so on. But of course, this is not enough. And especially for the big player in the field here, the National Health Service that I mentioned before, which is the biggest player of digital healthcare and IT solutions in the UK. And I would like to tell you a little bit more about this unique system here. What you should know, the NHS is, when we speak about the NHS, I mean, we will probably talk about NHS England more, but there's 4 independent organizations representing each of the UK countries. So there's an NHS England, NHS Scotland, NHS Wales, NHS Northern Ireland, and all of them are independent. It is a fairly old organization. So NHS England was the first one being established just after the Second World War. And the mission was to provide, and still is, to provide universal free healthcare services for everyone universally. And this is very important, and this is to be stressed, because this is something where the UK and the public is very, very proud of, so that basically everyone can access the healthcare service for free. Everyone, and here everyone we mean everyone who is a resident in the UK, which was even more blurry when the UK was still part of the European Union, because basically you do not need an e-card or any form of special insurance card, let's say it like that. So everyone can walk in to a hospital and expect free service if you are an ordinary resident of the UK. It's also unique, the system, because it's public funded through general taxations. So the money is for the NHS is coming from the Department of Health and Social Care. And because of that, it is also a very political topic. The NHS is all over the news. Maybe you remember this little picture here, the NHS bus. That was one of the main campaign points by Boris Johnson during the Brexit campaign, where he promised this 350 million a week that UK paid the European Union to go to the NHS. This was very politicized. And because the NHS has a very high public standing, this was one of the key drivers, and probably also a very big influence on the whole Brexit debate. You also see on the top this picture where, during the pandemic, the public support was very, very strongly, much stronger than I know from other European countries. So this is also something as a backstory to know in mind when you're doing business in the UK, when doing business with the NHS, that this is a very, very important topic. The previous slide I want to show you here as well, which is quite interesting, comparing different countries. The axis affordability versus performance, where the UK is on the very left side in terms of affordability. So it is free for everyone. There's no prescription tax or anything like this. So you're on the very left side. Usually the performance also used to be excellent. It dropped off a little bit in the last recent years, because of some of the challenges we're going to address later. But this is also a very good comparison, maybe for some of you from other European countries, to have a little bit of benchmark. It is also one of the largest employers in the world. So 6th largest employer in the world, actually. It's only I think the largest employer is the US Department of Defense. And then there is 3 others, but I think 1.5 million is on par with Amazon. So it is a big employer. It is also the institution with the largest budget. Again, something to bear in mind when doing business with the NHS, that they had for 2022-2023 180 billion pounds of budget available, and this is going to be expected to stay the same. So there was a bit of a bump during COVID with extra funding, but for the next 2-3 years, again, the Department of Social Care and Health have pledged 180 billion pounds to provide for the NHS. Right, and I've mentioned it already before, and also one of the reasons why the NHS is very politicized and in the media all the time, because of all these challenges that they are facing right now. And this is the list of the challenges is not from me. I could have easily named more of them, but this is coming from the Institute for the British Medical Association, which has published this article here very recently, where they list the challenges because of the years of mounting pressure on the NHS from chronic understaffing, poor retention, outdated IT. We're going now towards the technology side of things, and the long waits and waiting lists for patients that we have. We will talk a little bit later again. And of course, COVID-19 has not helped and made things worse. And, they even tried, the last point here, to outsource their services to private hospital care. But here, the extent to which the NHS can purchase actually private routine activity going forward remains unclear, and growing number of patients actually choose to self-fund due to the restricted NHS access. And this is just a very logical thing. If you have to wait for a hospital appointment or a doctor's appointment weeks and months, then you have only three options. You decide you're going to wait a couple of months and you feel like this is not very important. You just cancel the appointment and hope for the best that everything works out fine. Or you go privately and pay for yourself. So this is also a dilemma that the NHS is currently, of course, facing. And now I'm adding towards the challenges, the business opportunities for us. And I summarize all these challenges that we've heard before into these three categories. So it's workforce, waiting list, and money. So if you have any solutions, and I've listed some of the solutions below, from automations, robotics, telemedicine, AI, very important recently, digital for social care, or anything that can streamline pathways, make some routines more efficient, or provide faster diagnostic services. All these points and all these solutions would benefit and sort out some of the problems that the main challenges they're facing right now. Doctors are striking in the UK quite regularly for more pay. They're feeling understaffed, undervalued, underpaid. There is a lack of staffing, which has also an effect on the waiting list. This is the second point. We are on an all-time high in the UK on the waiting list. It's 7.6 million people waiting for hospital appointments and treatment as for now. And you see on the top right, again, what I've said before, very politicized. Cutting the waiting list is one of Rishi Sunak's one of the 5 top priorities. And he has pledged to halve the waiting list until next year. He's backtracked in the last couple of weeks saying this will probably not be possible. This is a big issue. And of course, you see the graph in the middle of the screen, the numbers are going up. And of course, everything is connected to money. So, the funding part the funding pot of 180 billion is big, but the most majority, of course, goes into salaries, day-to-day equipment, and so on. But also, if there's anything that can help the NHS to save money and be more efficient, I think you're going to have open eyes and ears for your solutions to be heard. Now, in terms of what is actually the plan of the UK government to solve all these challenges, and what is the connection with digital health. So here is a very recent report, the 8th report already on this topic, the Department of Health and Social Care. Has identified digital transformation as a top priority for itself in NHS England. They've very recently, last year, published a new plan for digital health and social care. This is the first time they're actually addressing one of the big topics I've previously touched on, that one of them, the major challenges, of course, is the social care aspect of it. And this has been neglected in the past. And you can see on the bottom, there was something called the NHS long-term plan that has been published in 2019, which obviously was before the pandemic. So this has been outdated and updated as well, but also lacked a little bit the social care aspect, which has been now updated a little bit. So if you are interested in the long-term plan, here is the website that you can read all the aims and the goals for the next 10 years. And they have various aims and various pathways. The aim is to provide more digital services, more tools, electronic records, as mentioned already before, and it's one of the 3 challenges, to support with administrative tasks, freeing up time for doctors, for them to spend more time with patients. There are other policies in place as well. A separate policy paper just focusing on the social care. The social care white paper has recently been published in 2021, updated last year, where they pledge 150 million over 3 years to deliver digital transformation in the social care sector. It's all about collecting data, integrating the systems with the NHS, or even like basics, like providing better internet connections in care homes. One other policy I found quite interesting, that the GPs, the general practitioners, the basic doctors, have been encouraged to deliver digital first approaches for the patients, so digital access, medical records, and e-prescription services are being used more and more frequently in the UK. Of course, it's not all about England. All the other countries have their strategies in place as well. Scotland with their digital health and care strategy, again focusing more and more on the social care element. They identified 4 priorities for them in their digital strategy, where they also engage and empower the public, create more insights, and also accelerate digital innovation for the public health system more generally. So they've kept it quite broad, and collect now their solutions from both the public and the private companies, of course. The Northern Ireland and Wales as well. Just mentioning maybe Wales, quite interesting. They are now having developed a project, the NHS Wales app. Again, it should be the one-point stop for patients to book appointments, view the health records, e-prescribing, and so on, and also then, in order to access further services. Finally, some case studies, which I found quite interesting, and also touch upon one of these challenges that we've heard before. The first page, I'm going to focus on case studies, which are focused on the patient support and use telemedicine solutions for it. So my GP, again, something similar, like what's happening in Wales is an app on your phone where you can book appointments, prescriptions, medications, reminder. It's been used by over 10 million patients. Fairly similar is GP at Hand by Babylon, which is interesting enough, was one of the first companies, and it was a private company that established their online booking system. They actually come from fairly different backgrounds. In the beginning, there have been an AI symptom checker and an AI system, an AI platform, but then they've partnered up with the National Health Service and now provide their services to a large number of patients in and around London. Another interesting collaboration, patient-facing, is Sleep.io, which is developed by a private company, and offers digital therapeutic for insomnia for people who have problems with sleeping. And this app is now officially recommended and supported and endorsed after, of course, clinical investigation by the NHS. Another wearable device, if you can call it like that, is Moodbeam. It's a device that allows a fairly low tech solution where you have one button where patients can basically log how they feel, and this button is connected, and this wearable device is connected to your phone and streamlined to the NHS as well. Again, another example of successful collaboration with the healthcare system. Then moving on to more B2B and support for doctors or for the hospitals. The first two, larger companies that, of course, have also collaborated and worked together in the past and still working, like Google DeepMind's software platform Streams is an app to help doctors identify patients' risk of kidney injury. And quite similar, the software developed by Microsoft, InnerEye, is also used in multiple hospitals already. And they use machine learning and AI to automate the process of contouring, basically drawing the borders before a radiotherapy treatment, supporting the doctors, freeing up time, making things more efficient. And on the management side, the Edge Clinical Research Management System I found quite interesting. This is used by the NHS, by various NHS organizations, various NHS hospitals to streamline the administrative process. And finally, a software called Huma that captures patient-generated health data as well, and this data is being streamlined and being sent to the NHS hospitals, and their goal is to enhance patient monitoring and doing some research. So again, a slightly different approach, not really patient-facing, but getting the data from the patients and streamlining this in a way that's conforming with privacy and data protection. Finally, because I'm approaching the end of my time, a quick outlook on what we expect to see next. So the digital health sector and market is definitely expected to keep growing, and there is now a great opportunity for businesses in Europe due to the great acceptance as well of the use of the technology within health after the pandemic. So video consultations are already quite the norm. Interesting enough, the low-tech solution, the first step is the phone consultation, which is a high percentage of people are making use of, but video consultation is quite the norm, especially if the alternative is waiting much longer for an in-person appointment. But achieving the digital transformation has been proving to be challenging. This is not the first time the government, of course, has outlined in policy papers. And these policy papers, you always have to be careful and look at it with a skeptic eye. I think the first ambitious plan 10 years ago was to make the NHS paperless by 2020. It's now 2023. There's still a lot of paper in the NHS and in hospitals around. So the speed of the adoption also, of course, depends on the financial constraints, on the resources available. But there is commitment. Of course, you can see it in terms of the budget, and the budget is not being cut. The budget is being increased. And there are significant initiatives underway in the UK, through England, Wales, Northern Ireland, and Scotland. And they also aim to, of course, implement their learnings from the previous attempts that might not have worked out. We as Advantage Austria in the UK, we are having for the next 2-3 years a focus on healthcare technologies as well. We're going to provide in January our first big webinar for Austrian companies that want to sell their technology solutions to the NHS. If you're interested, especially now for the Austrian companies, of course, on the UK market, if there's anything we can help us, or if you're interested in attending a workshop or webinar, please let us know. The contact details you can see on the screen. Very happy for you to reach out and get in touch with myself and my colleagues. And with that, I think I'm exactly on time. I'm going to hand over to Lisa Maria. Thank you very much for listening. And I'm also very, very keen to hear what my colleague in Abu Dhabi has to say.
Yeah, thanks a lot, Mr. Pesel, for this interesting insights. It seems, at least when I'm thinking about the Austrian health market, that we have a lot of common challenges, and there might be some interesting opportunities for Austrian companies in this field, and also for European companies, of course. Yes, now coming to our next focus country, the United Arab Emirates. And Mr. Maya, we are really keen to listening to your words. The floor is yours, or the screen is yours. Somehow I cannot hear you. You're unmuted, but now I hear something.
Now it's working?
Yes, now it's working.
Okay, sorry. Okay, then I repeat my introduction. Thank you very much, Lisa Maria, for this introduction of myself, and also thank you, Peter, for the introduction to the British market. We are now focusing on the United Arab Emirates, and together with my colleague Shankar Menon, who is also online, we would like to show you a little bit about these countries. Now let me share the screen. Okay. Okay. So my name is Christian Meyer. I'm the deputy head of the Advantage Austria in Abu Dhabi, Außenwirtschaftscenter Abu Dhabi. And my colleague Shankar Menon, who is more on the subject basis, he will also deal with any questions in case there are. A brief overview for European companies. The agenda for today is the following. First of all, we would like to have a look on the market. Secondly, why United Arab Emirates? Third, the opportunities and of course also some weaknesses of the market. And fourth, we will give a short conclusion for our listeners. Generally speaking, the healthcare sector in the UAE has been of very great importance from the very beginning. So back in the 1970s, already the government was focusing on developing a very strong healthcare market for its population. And also now, on the right down, you see from 2022, the current president, Mohammed bin Zayed, also pays a lot of attention to a good healthcare sector in his countries. Let's have a look at the healthcare landscape in the United Arab Emirates in general. There are more than 160 hospitals and more than 18,000 beds. So we can say that per 1,000 residents, there are about 3 doctors and 6 nurses available. The federal budget allocation for 2023 for healthcare and community protection is about 7.6% of the general budget. And the healthcare expenditure actually is growing in quite good numbers. So when we look into the future, by 2029, the healthcare expenditure on public and private side is expected to rise to approximately 107 billion dirham, which is about 5% of the total GDP. The United Arab Emirates are also one of the top 20 countries in the world when it comes to healthcare spending in general. Talking about the e-health landscape, then we can say that the revenue in digital health market is projected to reach about 536 million US dollars in 2023. And it should have an annual growth rate of about 13.5% with a projected market volume of 1.011 million by 2028. The average revenue per user is expected to amount to $62.5, and the user penetration in digital treatment and care will be 47% in 2023 and is expected to grow to nearly more than 50% by 2028. Why should you come and have a look to the United Arab Emirates? Generally speaking, there's a strong government support and focus on health IT, telemedicine, and digital medicine by the Department of Health. The Department of Health has already initiated some projects like the AI Lab, Malafi Research and Innovation Center, or the virtual hospital with remote care by doctors. The legislations to ensure access to healthcare include mandatory health insurance for all residents, both local and expats. As you might know, there is a big number of expats in the UAE, and it doesn't matter if you're local or expat, you have access to all of those health care institutions. The good thing to mention is also that foreign investors can have ownership of 100% in healthcare segments. So, what is also important when we talk about IT or health, e-health, it's not in order to save costs, it's mainly to promote an integrated experience and improve the patient outcomes. Generally speaking, the population here is very technology savvy, so they all have their iPhones, or sorry for the marketing. They all have their smartphones, let's say, and they are used to dealing with these on the phone. There's a growing healthcare infrastructure and an increasing demand for innovative solutions in general. Some three best practices which show you the integration of foreign investors in the UAE. We have here the medical city Sheikh Shakbut in partnership with Mayo Clinic. We have the very big Cleveland Clinic in Abu Dhabi, or the King's College Hospital in Dubai. So as you can see, there's quite a big number of foreign investment in the country. An important project is the Emirate. Peter just mentioned that for everyone who is living in the UK can walk in and have any access to any services. In the UK, it's a little similar in the Emirates. Also here, you do not need a separate ID in what we would call in Austria the E-card in order to get access. Instead, it's enough if you have your Emirates ID. This already shows that you are also insured and that you have gained gain access to all those services here in the UAE. The Emirates Health Services, shortly EHS, is running pilot projects that targets e-visits, electronic medical records, electronic health records, telemedicine, chatbot services, predictive analytics, and mobile applications. And they launched a project called Care AI, which tracks patient behavior and patient movement and uses computer vision to assist doctors in diagnosing patients while automatically updating and analyzing patient data using artificial intelligence. So as you can see, there is already quite some basic ground when it comes to e-health, which has been prepared by the Emirates ID card in general. The point of regulation, of course, is very important. Regulatory and compliance considerations have to be kept in mind as always. The products related to the healthcare sector are strictly regulated. So please be careful when you bring in your product. Make sure that it has been approved. And here we are talking about separate authorities which are dealing with approval, verification, and issuances of licenses. Just to give you an idea of some of those, like the United Arab Emirates Ministry of Health or the various departments in the various Emirates. So wherever you try to enter the market, please make sure that you reach out to the correct authorities in the first point. Let's have a look at some of the opportunities and also some of the weaknesses in the market. There is a shortage of medical professionals and healthcare institutes. So it would be, you would be welcomed to fill up this shortage and bring your own personnel, because there's also a shortage in well-trained personnel. Public-private partnerships are very much welcomed. So this is a big advantage if you want to invest a couple of money and bring your own investment. Growing prominence of home healthcare services is another opportunity. Digitalization of healthcare and virtual medicine gaining significance, we can also mention here. And the regulatory authorities display openness towards futuristic technologies. So they are very open-minded to when it comes to e-health and all of these issues. The final goal is digital transformation of the healthcare system. For the healthcare or e-health solutions for the UAE market, what is needed? Integrated electronic health record solutions, health information exchange. EHR need to be integrated with both private and public healthcare providers, teleconsultation platforms, health research and analysis, for example, big data analytics to better understand healthcare needs of the population, and partnerships with local healthcare providers. What are the weaknesses? Well, as I mentioned already, the homegrown market is not very strong. So actually for foreign investors, it's an opportunity, but for the own population, it's a weakness in case anything happens. So there's a lack of well-trained homegrown personnel as well that specialize in healthcare data integration. So if you have a look on that, you bring your own personnel. And the lack of fully unified set of rules across the UAE when it comes to healthcare-related compliance. So this I mentioned just a few minutes before. Please make sure that you really apply to the right institutions. As a conclusion, if we sum it up, we can say there's a strong governmental focus on health sector and the commitment to digital health initiatives, which will help foreign investors to come into the market. The population is very familiar with digital solutions, so they're very open to any kind of these new techniques. And it's a highly promising and attractive market with tremendous potential, which you always should keep in mind. This is the address where you can reach out to us, abudabi@wko.at. And if you have any further questions, me and my colleague Shankar will be happy to help you with that. Thank you very much. And with this, I would like to give back to Austria.
Thanks a lot, Christian Meyer, for also this very interesting inputs concerning the United Arab Emirates health market. Also a lot of challenges, of course, but also chances for European companies. So, dear participants, now it's time to answer your individual questions. Please write them into the chat or switch on your camera and mic. We will answer your questions one after another. Are there already some questions? Let's wait a little bit. Huh. I see there's something in the chat. A question for Mr. Pesel. How would you assess the chances for a foreign company to become NHS supplier?
Very, very good question. Of course, the answer is it depends. Depends on the company, it depends on the solution that you're providing. So if you have a technology that that is matured, that has already proven some records, maybe in another European country, and which is solving some of the challenges that we've outlined in the presentation, making streamlining processes, making processes more efficient, automation, or providing solutions for the social care sectors, then of course the solution, the technology itself would be of interest. Of course, what is always helpful is if you have already some market knowledge or already some data from the UK. So sometimes it's depending on the solution. Sometimes it is helpful to have already a British partner to maybe perform a small clinical study. It is of course helpful if you already have data from clinical data from your home country or foreign country. But of course, the UK market is slightly different than the rest of the world with what we've established right now. And your chances for a foreign company to become a supplier, of course, increases if you have already proven that your technology, your digital solution is safe, and especially in regards to the UK market. So I think this is definitely a benefit. But even without that, if you have a strong track record in Austria, in Europe, then of course this would be already evaluated, and there's a streamlined process, and their chances are quite good that you will fulfill the criteria. Basically also because the regulatory framework was until recently quite similar, not to say the same. So it's just the last 1 or 2 years that the European law is deviating from the British law. So if you have already a solution that is working in Europe, you have a very, very strong business case that this is going to be of relevance and also fulfilling the regulatory requirements within the UK. But of course, you have to do whatever British company and British solution provider needs to do. If you have a solution, you need to register with the Medical Health Regulatory Agency, the MHRA. You need to have a responsible person. You need partners. It is not straightforward. There's effort if you want to enter the UK market, but it can be highly rewarding. So if you are successful and have a successful bid within the NHS, then of course this is proven that you are maybe you have access to a large pool of hospitals, you have a large pool of patients, and I think then this can be quite rewarding.
Thank you. There's another question. I think it's directed at Mr. Brunner, but I think Christian Meyer is meant. You mentioned a huge potential for digital health in the United Arab Emirates. How about local competition? Are there specific niches you're aware of that don't have local solutions yet?
Okay, thank you very much. May I ask my colleague Shankar, can you give any information about that?
Yes, hi. Good morning, everyone. Thank you for giving me the opportunity to speak. My name is Shankar Menon. Just to give you a quick background, I work with Mr. Meyer and Mr. Brunner in the Abu Dhabi office, and I have helped in the past with the healthcare reports and looking at the healthcare sector in general. In particular, there are certain niches when it comes to e-health. Yes, at the moment, the biggest concern that the UAE government, or at least Abu Dhabi and Dubai governments, are having is getting the public records when it comes to e-health into play. Getting all of them together into one platform where it is easily accessible for the government to access them, and also make it easily available to all the hospitals, whether it's private or public. So this has been a big exercise that has been going on for, I think, the last, I would say, about 4.5, 5 years. It's each and every hospital that is coming online, or being built, so to speak, has to now conform to that. So getting those kind of the software and the hardware in tune with the regulatory requirements is the big demand at the moment. And that is one big niche that is being looked at quite significantly by the government and by the private authorities. So if there are any Austrian companies over here that can assist with that, that would be something that we can definitely talk about going forward.
Thank you. And another question came in the meantime from Silvia Ralli. I'm an Athens Greek medical tourism luxury marketplace and facilitator, and want to have digital transformation via AI assistant of my services. Is there interest for this sector of development? Maybe UK first.
Right. So generally, AI assistance is always, I think, on the radar, because it can be a very efficient tool to support patients. I think in that case, if it's not an AI assistant dedicated to facilitating to doctors, and it's more like a leisure product, or more like a luxury product, it might not be the NHS that is of relevance. But definitely also the luxury sector in the UK is quite strong, and I think this is also an area that there's a lot of potential out there. And we've already seen the last couple of years that there have been some solutions that have been tested and very successfully implemented. So from the UK side, I would see this to be a quite interesting market.
Thank you. How is it in the United Arab Emirates?
I actually would say the same thing. There is a lot of experimentation, especially with AI, or at least let's talk about it at it's just starting out. The AI revolution is just starting out in the UAE, and the more than the public sector, I would say the private operators are looking at AI, especially because now the UAE is looking at becoming sort of pulling in medical tourism into its own borders. See, the UAE until about 10 to 15 years ago had they used to send all their their patients out to other countries, like to the UK, to Germany, and to Austria, and to and to the US, for complicated issues that they could not fulfill locally. But in the last 15 years or so, the mandate has changed completely. They want to build the in-house expertise in the UAE itself, and they want to keep that money in-house. So a lot of public institutions have opened up to to take care of its of the residents that live over here, the local population, as well as the expat population. But private institutions are looking at increasing the number of people that are coming in. So from different countries, maybe from the APAC region, or even from Asia, from Central Asia, from the CIS states, and to attract those clients that would essentially not have that kind of experience in hospitals over there, and to bring them over here, they are looking at newer ways to attract that clientele. So maybe AI could be a way that they're looking at. So I would say, not look at the public sector so much, look at more of the private players over here that might be willing to experiment with that. There's a company called Aster Hospitals, which is a big private operator over here that has been experimenting with that. I'm not sure at what level. I'd have to get back to you regarding that. But they have. I was reading in the news that they are looking at integrating AI into a lot of their systems over here.
Thank you. So I think we have time for one last question from Ms. Rupp. If I have a medical product that is already registered certified for the EU market, which further steps need to be taken to get it registered in the United Arab Emirates? What would you suggest to start with?
So depending on the product which is going to be coming in, you do require, even if it is registered in the EU, you have to get it registered with MOHAP, which is the Ministry of Health and Prevention over here, which is a federal body. And then depending on like whether it's a diagnostic product or not, you would have to probably go with an ECAS registration, which is the Emirates Conformity registration, so to speak. There are certain different zinc products, certain different regulations that they look at, but each one of them has to be verified. Like, you have to have a local registration company over here, or a local company that is essentially that is registered with the authorities, that can essentially be a distribution partner over here, and then only will they be able to apply for the regular registrations that they have. So you cannot, as an independent Austrian company or being in Europe, bring your product in without being locally registered over here. So you have to have a local partner that will help you with that. That is registered with the individual authorities. I hope that answers you.
Thank you. So to conclude the webinar, thanks a lot to our speakers for their valuable insights. Thank you, dear participants, for your interest and your active participation. I wish you all a nice rest of the day, and I hope to see you again soon in one of our other Desire events. Thanks so much.
Thank you very much from Abu Dhabi.
Thank you very much. Bye-bye.
Thank you.
Bye.
Thank you very much.
Bye-bye.
Thank you very much. Have a good day.
Thank you.
Bye-bye.
Thank you.